You're listening to Radio Sultanate of Oman on your favorite radio station, 90.4 FM.
The Modern Family. Let us bridge the gap between generations. Let us shape up the modern family. The Modern Family. The Modern Family. Join the discussion and give us your feedback. Live with Hatem Al-Abdussalam and Dr. Wa'il Al-Harasi. The Modern Family.
In the name of Allah, most gracious, most merciful, all praise be to Allah, the Master of the Day of Judgment, and peace and blessings be upon our beloved Messenger Muhammad sallallahu alaihi wasallam. O Allah, grant us knowledge, wisdom and sincerity. Dear brothers and sisters, we salute you all with the salutation of the people of paradise. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for tuning in to your program, The Modern Family. Today we have a new episode with an honorable guest. But before that, we'll say Assalamu alaikum to Dr. Wa'il. How are you?
Alaikum assalam wa rahmatullahi wa barakatuh. I'm fine, thank you. How are you?
Fine. How was your day?
Alhamdulillah, good.
Alhamdulillah. Okay, we have an honorable guest today. We have Dr. Harith Al-Harthi, who is a member of Communication and Media Committee at Oman Medical Association. Assalamu alaikum, Dr. Harith.
Walaikum assalam wa rahmatullahi wa barakatuh.
How are you today?
I'm fine, alhamdulillah.
We are honored to have you on the show, and in a very short notice. But we're sure that inshallah you'd be very beneficial for the show, and for all of us will benefit from.
He had to go through a lot of approval, approval system. A very
we don't want to embarrass him.
But he passed, alhamdulillah, and we're proud of you. And Hatem, we are also very happy to have our hands on a doctor, finally. Because we were really very harsh on doctors. In the past few episodes, past few weeks, we were really angry. But today I think we brought a good doctor.
Hopefully we'll bring calm to the environment today.
Inshallah. We brought in one of the good ones.
I'll be the mediator between both of you, and but if you feel like punching each other, then you can go outside and
No, I don't think not with Dr. Harith. He's very dear to us.
Okay, today's topic is family reaction to their children's illness.
Yeah.
A few days back, me and Dr. Harith, we met at the market, and we were discussing this issue, and that illness happens in many families, and especially to our children.
Yeah.
And how is that illness related to health, and how does it affect the child and other children and the family and
the dynamics within the family.
So maybe today we'll go into details and discuss more about this. So tell us more about illnesses, Dr. Harith.
Thank you very much for inviting me. A few weeks ago, I was following your beautiful program, and at that time it was Sheikh Ali, I believe, was the guest, and he was talking about his daughter being diagnosed with deafness at a very young age, and how he reacted to that. And I think Sheikh Ali set a very good example of how a family could react to such a news. Yeah. And in this episode, we'll try to dissect maybe his experience a bit further, so we come up with maybe advices that others can follow and come out of it victoriously as he did. And also his daughter have made remarkable achievements, learning languages, etc., while she initially had deafness.
Yeah. No. I think after speaking to Sheikh Ali and Yahya on that episode, who also had a disabled child, we talked about other experiences where families probably would have reacted in a positive way if the way the news broken to them was done in a much more professional way. So probably they have attributed part of their denial period or even to the stress caused to the way the news was broken to them.
Yes.
We have spoken to a couple of parents 10 years apart from the two incidents. One, she had a child who's now 11 years old. The other had a child who's just
18
months old.
months.
Yeah. So about 10 years between the two incidents, but the similarities are, they're almost identical. The way the news was broken to them, they said it was very casual, and after that, no guidance whatsoever, and they were left to deal with it on their own. Both these families. So I think your definition earlier, before the program, of health meant that the overall health within the house, within the household,
will be affected.
Was affected.
Yeah.
And probably the listeners do not know about the particular definition we are referring to.
Yes.
So please, could you please enlighten us on the definition of health?
Yeah. When it's never a light news when you are told that your child has illness, especially a serious one that will require prolonged treatment. And I think you need to understand from that moment, it is not the physical illness only that can affect you, because health is not only it's a status. It's a status of complete well-being that you experience, not only physically but also emotionally, psychologically, even spiritually. If you are not in terms with your God, with Allah, you will experience illness, and it actually comes within that definition as well of health. So when a child feels or get diagnosed with an illness, we as parents, we react to that news, and you can say it's like more of a sympathetic kind of illness that we experience as well, and it's a true and fits within the definition of ill-being as it is used by WHO and other organizations.
So
now.
illness is not physical illness only, but it could be emotional illness.
Yes.
It could be psychological. It could be all sorts of, and let's say, unhappy feeling.
Yes, actually all of these parts are determinants that determine you could say I am 100% healthy or 99% healthy, and the less percentage you have, the more you will experience symptoms of the illness.
Okay.
So all of these are determinants or contributors to your overall health. When a child is diagnosed, I don't think it's the breaking of the news that is the most important. It is definitely very important, but the families could be themselves the leaders of the situation rather than passive reactors to person A or person B breaking the news in a casual way, as you put it. But I believe that families could be empowered, and hopefully within our program today we will give them the tips to take control of the situation, because the moment you get a news, you feel very much like you've been shattered into pieces. And this, I'm talking about an experience that happened even to me lately. Regardless of how well trained you are or how knowledgeable you are, that news is never an easy news to accept. So you'll blame the doctor of the way he broke the news to you. You might blame the services of how much they delayed. And all of these actually are recognized phases of grieving process that we really need to go through. I've passed through them, and many parents passed through them as well. And speaking today is not, I'm not wearing the medical hat now, but more of someone, of a parent who experienced this. And I'll try to share with the audience maybe how I came about to manage it. You cannot control it completely, but more of like management task here.
Dr. Harith, sometimes it's really difficult to say that the key person to manage the whole situation, the parents, because they are emotionally involved already. Just from the moment they realized some symptoms, not knowing what it is really, they're already into pieces, not knowing what to anticipate, what to wait, what
Maybe
are they waiting for?
The severity of
the severity, and
the grieveness.
I could share first my own experience with my child. My second child, when he was about 6 months old, he started developing a very peculiar symptom. Whenever he starts crying, he would faint immediately. He would be unconscious. He would turn blue and be unconscious. Me and my wife at that time, we were very young parents. We didn't know what to do. What we did is we couldn't allow him to cry. Whatever he wanted, we'll give it to him almost immediately.
Yeah.
Because the time when he starts crying, then we all go into a panic mode. And he wasn't the only child. He was the second child. We had another child to care for as well. It took us a very long time to take him to doctors, time after time. And they couldn't see anything because it wouldn't happen when he is at the doctor's unless he's crying. And I remember once I took him to the hospital, to the emergency, after he collapsed at home. And I rushed him to hospital, to the A&E, almost midnight. And they said, we need to do a chest x-ray. While they took him to the bed to do the x-ray, he started crying, and he fainted
again. Yeah.
Yes. At that time, I was in tears. I broke to tears. I couldn't. I said, please help me. I see my child dying. So I wouldn't expect to be able to handle that situation.
But you could.
At that time, before even the news broke to me what is wrong with the child, I was into pieces.
No, but I think maybe it depends from a situation to another. You have different cases, and as I said earlier, the severity of the grieveness it differs from one person to another, and maybe breaking the news helps in bringing down that severity.
What I was trying to say from that story is that even before even knowing what's wrong with my child,
it's already difficult.
It's already difficult.
Yes.
Yeah.
But we'll try in this program to at least dissect the different components that shaped your reaction. I think if we'll put it in a bit more clear way, and maybe I've read about it as well when I experienced it, I think it's all about three components.
Okay.
First component is your knowledge. Earlier, you didn't know what's wrong with my child. He just turns blue, and your brain flies automatically into maybe he'll die, right?
Exactly.
You don't know. It might be something maybe minor to you in reality, but because you lacked the knowledge about it, then you couldn't control your thought process properly. That's one. Second, I think it's very important to recognize that there are what you can call it circles of support that you could use. And at that time, I didn't take him to the hospital because maybe I thought it's only about the crying. If you knew that perhaps the hospital is a resource that you could use to come up with an answer to either direct your knowledge toward, now I've read the causes of fainting after crying in babies of this age is A, B, C, D, and I came to that knowledge by just Googling, Go to Google or Bing or wherever and just put child fainting after crying,
The reason we didn't do that is that there was an incident before it. He was eating once. He was holding some food, eating. His elder brother just pulled his hair. And he started crying and he choked. It took hours away, and his mother, when the mother brought him to me, he looked like a dead body. His eyes rolled up, his face totally blue, and I was attending to some guests that I had at home, and he was almost like dead meat when he was brought to me. So immediately I tried to. I'm trained to do first aid to children. So I tried to do everything. It didn't come out. He didn't cough it out. So all I did as a last resort, I put my finger in. As soon as I put my finger in, he started breathing. He breathed heavily and started crying. He was fine, but that took about 30 to 40 seconds, by the way.
It's horrible.
It's horrible.
A 30-40 second must have felt like it's 3-4 hours.
Yes, but alhamdulillah, I think that Allah subhanahu wa ta'ala gave me strength, because his mother also is a trained first aider, and she worked in hospitals as well. But as a parent, when you're also emotionally involved, it's quite difficult.
True.
Yeah. So
I think that's the third component. So the first one is the knowledge. And the second one is the circles of support that you need to know about, and also you need to organize them around you.
Okay.
So that a child as an individual, he has also circles of support.
Yes.
And you as a parent, you are one circle. You need to keep that circle intact around him so that he benefits as well. And then around you there will be other circles. So you have families, you have services, you have social workers, you have government institutions, you have, you name it. The wider you go, the more circles you have, and the more resources you can pull in. The third component is you yourself. So the attitude part.
Okay.
So the attitude part, at the beginning, I believe nobody can control it. I mean, the more, as you put it, I felt like my son is about to die. You know, at that time, regardless if it's you or me or anyone else, you tend to panic a bit.
Yeah.
Right? Momentarily, at least. And then once that moment is over, and eventually it will pass those 30-40 seconds that you reacted correctly, I think a longer process starts. So we need to, for us and also for our wives and our parents, it's not us only. A big problem is families don't communicate a lot when it comes to these experiences. You need to, in circumstances like these, you need to enhance your communication with your partner. So express to her if you are the husband, or express to him if you are the wife, how do you feel about it?
Yeah.
Get closer to each other. Share your, at that time, it's not only you need to support the child, but you yourself, you need support. And that support is you expect it from your partner. But your partner is in the same shoes as well.
Yeah.
And they expect from you to support them.
Exactly.
So at the end, you might feel more like your partner is not supporting you enough, and they feel vice versa. And I was talking to pediatric oncology. These are pediatric cancer doctor, and he was telling me that they've noticed the number of divorces between parents of children who experienced cancer, and they went through the treatment, regardless if it was successful or the child died. The number is much higher than normal, and it's pure stress and sheer, difficulty of coping with such a news, like the illness of a
so
child.
It could reach to that extent where it put a lot of stress on the relationship between a husband and wife.
So parents need to be careful, and
they need to be
try
careful.
Prepare yourself for such things.
Yes.
So the first thing to parents, be knowledgeable. Try and acquire knowledge.
Yes.
Enhance your communication.
Yes.
Secondly, know your resources, what's available there, what sort of support is available there, be it private or government.
Yes.
Yeah. And thirdly, it is
The
yourself.
attitude.
Gratitude.
Yes.
Yeah.
And I think in the attitude part, we need to understand that there are some norms that you need to pass through. If you came to acceptance immediately, then there is something wrong with you. You didn't. It's a process that you need to pass through step 1, step 2, step 3, step 4 to come out of it in a healthy way.
Normally people say denial, the first thing.
Yes.
Yeah. You go through a denial. No, this couldn't happen to me or my child. Something must have been wrong. I'll take second opinion.
Doctors are wrong. Yeah.
Doctors are, I'll take second opinion, which is absolutely right. They have all the right to do so.
Yes.
Because it could happen that the first doctor might have not interpreted the results correctly. There is human error there.
But again, I think, Dr. Wael, it's very, very important to establish the relationship between the doctor and the patient as well, to gain the trust back.
Yes, it's a team.
Yeah, how can we help parents by breaking the news? What is the best way to break the news?
Yes, I think they are actually, most of the doctors are trained on how to break such news, especially pediatric doctors.
Mm-hmm.
And it needs skills as well as the setup. Sometimes the setup is not there, and unfortunately that is the situation in many places.
In Oman?
Even in Oman, yes.
Yeah.
You need a private place. You need also skilled people as well. Someone who break such a news, in my opinion, shouldn't be someone who is the junior most in the team, in the treating team, but rather someone who is senior as well. You, as you said, you are in a denial at the beginning, and the person who speaks to you can anchor into you the belief that this is actually the right diagnosis, and instead of your denial phase taking months, or even getting stuck in the denial phase, you might come out of it in much shorter time. So I think it's the setup, it's the person, it's the skills. All of these can make breaking news a much smoother experience for the parents as well.
Okay.
Yeah.
When we talk about illnesses and sicknesses, there are some acute illnesses and there are also some chronic illnesses.
Yes.
How can parents deal with these? In our program, we talk about disability mainly. Diabetes sometimes could be seen as a type of disability,
yes.
Depending on the severity of diabetes. And it is also very common, I think, in Oman, even in children. How do you advise parents?
I think illness is an illness, even if it's a simple cough or upper respiratory tract infection, or maybe diarrheal illness, or now it's very common chicken pox, let's say. During that period, you need to go again. You might not have that very strong denial. It might be something easier.
Yeah.
But still, the effect of it could be accumulative, and also at the end disastrous. If as parents, let's say you have 5 kids, and then one gets this illness this month, common things like common cold, etc. Yes. If you, as a husband, you don't support your wife, and you take it, a child is sick, let the mother take him to the hospital, it's business as usual next day, and you can come late from work, and she might be also working. At the end, she might be feeling very stressful.
That sounds like me. Okay.
Yeah, I think we could be chipping in a bit more in supporting our partners in that field, in that aspect. At least you need to do a bit more of your time management, maybe tasks management as well. A sick child doesn't need only to be given medicine. He needs actually to get closer to his parents. He needs love, he needs affection. But at the same time, a child who has flu can infect you as well.
Yeah.
So while you are caring for that particular child, you need to take into consideration that there are other children as well, and then there is yourself. If you get sick, then you cannot help that
sick child.
Yes, it becomes really, really difficult. So I think even simple illnesses they require adjustment within the family.
Yeah.
Yes.
No, I think it would be very beneficial for us to talk more details about the time management and sharing of responsibilities between parents of a sick child or sick children. But first, you mentioned that you would like to tell us your own experience.
Yes.
And share your experience with us. We're eager to listen to you, to what happened.
Before that, I think would like to remind our listeners of our numbers 24602058, 24602058. You can always call us and share your stories and thoughts, and maybe you might agree or disagree with us. Today we have Dr. Harith Al-Harthi with us, so you can ask as much questions as you like.
I think among us, our experiences count a lot. I wish if within Oman we have more of support group services. Last August, my son was actually diagnosed with an illness that he required surgical and then medical prolonged treatment for that. Despite being a doctor, despite my wife being a doctor, it wasn't an easy decision for us. It's the choices that you have to make. Nowadays, or since long time actually, or since the beginning, medicine is about giving you options that you need to choose from. So that the choices that you have to make are never easy actually.
We have a call from Dr. Salim Al-Miskri, who is the Director of Child Health Department, Head of Pediatric Cardiology. Assalamu alaikum.
وعليكم السلام ورحمة الله وبركاته.
Assalamu alaikum.
وعليكم السلام ورحمة الله وبركاته. أيوة
I can't
اسمعك.
hear you, Dr. Salim. Assalamu alaikum.
وعليكم السلام ورحمة الله وبركاته.
I think the mic is not connected to the room.
No, it is.
We can't hear him. Okay, I think we'll call him again. Yes, you're saying, Dr. Harith?
Yes. So I think it's the choices and making them which is really difficult. Like, is it the best treatment that I'm offering to my son? Will he get complications out of this? Is it important to put a cannula now? Is it important, instead of putting this type of cannula, is it a different type of cannula?
Is it because you're a doctor you think of all of those?
I think definitely yes, but even for other parents, it won't make much of difference, because doctors will come to you and they will tell you that your son has this and this and this, and this is the treatment plan that you have to work.
They will tell you of the best, let's say, 3 options available there, but as a doctor you are aware of tens of options available.
But what Dr. Harith is trying to say, Dr. Weil, is at the end of the day they are also parents.
Absolutely.
Although they're having the medical background, they also go through stress and panicking, and sometimes you feel that you're helpless, you can't help your child. So the same emotions apply to them as well.
Definitely. And I think at that particular moment you might make a lot of wrong decisions. So that at the same time my son was diagnosed, another child was diagnosed. But for me, I had to sit, read about it, acquire the knowledge, and then work on the attitude part, and then organize my support cycles within, like, me and my wife and our family, and then within our expanded family of brothers and sisters and cousins. We might have to be away for some time, who will take care of other children as well. We might have to make adjustment within the family, so his immunity might be different. He will require a bit more attention. And then at the same time, you really don't want the other children to feel that you are giving more care to sick child
Absolutely.
compared to the rest as well. So you'll have to balance so many things at that same time. And the only way for you to do is to come into the facts. If I have an option that is available, let's say in Oman, what about if I go to another country?
Yeah.
Dr. Harith, we have Dr. Salim al-Maskari on the line. Assalamu alaikum, Dr. Salim.
Alaikum assalam wa barakatuh.
Assalamu alaikum. I think we still can't hear him.
Alaikum assalam wa barakatuh. Asma'akum ana.
I think he's on air.
Yeah,
but we can't
listen.
We can hear him.
Might be a technical...
It could be. It could be. We'll continue.
Dr. Salim is a very, very busy man, and I hope we'll be able to get him later. He's the head of pediatric department in Royal Hospital.
Yeah.
And it's very kind from him to join us actually today.
Dr. Salim, we are really sorry about this technical glitch. I hope you're with us on air, but we can't still hear you.
No problem. I can hear you very well.
Yeah, I could hear his voice very far.
Yes.
But I think it's playing from the control room.
From the control room, yes.
Yeah, not from here.
Yeah. I don't think it will be possible for us to speak to him. Anyway,
I hope they'll work it up.
Yeah.
So, at the same time, my son was diagnosed. Another child was diagnosed, and again, for them to make the decision, should he be treated here in Oman or should I go somewhere else? And they ended up wasting almost, let's say, a month of precious time.
Yeah.
That the child was supposed to be getting treatment. He ended up going here and there and there.
The other child, you mean?
The other child, yes.
Yeah.
So when you experience this, I think you really need to become objective
and be decisive
and weigh things not according to what you heard from a friend or from a relative who will keep giving you all sorts of advices, but you need to come and look at your options and weigh them just as they are. So a medical treatment versus surgical treatment in Oman versus outside Oman. Share the experience with your doctors. Talk to them. If you are not happy with a certain advice from a doctor, usually hospitals, they have 2, 3, 4 doctors at the same, in the same unit.
And I think one very important question that a parent should ask is, how much time do we have?
Yes.
How much time do we have?
Yes.
It will give me as a parent time to think and weigh options. If I think that there is not enough time, I think all I'll need to do is just depend on the doctor to make the best of the decision. I wouldn't be able to make a very swift and decisive and informative decision immediately.
Yeah, like diabetes, as you mentioned, children with type 1 diabetes who will need insulin.
Yeah.
In these circumstances, usually children are diagnosed and they are in the hospital. Many families might be worried about, this child might have to, we might have to inject him with insulin 2 times or 3 times a day, or we might have to connect a pump to him. So we as parents, we tend to focus more on how the child would feel, how much pain he will feel, rather than what the benefit will be.
Okay.
So I think it's very important to be a bit rational at that particular moment and think that whatever I do, I don't have any intention to harm my child.
Yeah.
Whatever the doctors will do, they have no intention or no interest to harm my child. And whatever both of us, we and the treating team, do to the child, actually it is for his own good.
Yeah, absolutely.
Yes, and I think reminding yourself of that all the time is very important. Sometimes you tend to be a bit forgetful of that particular fact, and you might think that, somewhere else it might offer maybe easier options. But I think when it comes to especially serious or chronic illnesses, there is no easy option out of it. You really need to be control of the situation. You don't have to just follow advices without even knowing them. Don't never feel or get locked in a situation where you just leave it to the doctor to decide. It's really not positive or not healthy to just say, you the doctor, you know everything, you decide.
Yeah.
You really need to be convinced about it, because if you are convinced, you will not be passive reactor, but you will be actually active member of the treating team of your child,
of the decision making as well.
Yes.
Yeah.
Yes.
I think that's really very important.
I think we have Dr. Salim again on the phone. Assalamu alaikum.
I think it's ringing maybe now.
Yeah.
Yeah.
So,
I was wondering
Yeah.
I wanted to ask Dr. Harith that you are a medical doctor and you see things from a different perspective, and now that you are a parent and you have a sick child, do you see the world in a different perspective as a parent?
Definitely. I think it's an enlightening experience, and it opened at least my perspectives into understanding of health and life, and appreciating the different parts of of me as a human being, and appreciate more my family, work more to bond with them. Illness can bring a lot of benefit. The illness of your child. Yeah. If you work to harvest them, they can bring your family closer as well.
Inshallah.
Dr. Salim, Assalamu alaikum.
Alaikum salam wa barakatuh.
How are you, Dr. Salim?
I'm fine.
Sorry we had a little bit of hiccups from the technical side, but thank God that we got you online now.
No problem.
So how's things on your side, Dr. Salim?
It's fine, going on.
Alhamdulillah. Dr. Salim, as you are the head of pediatric cardiology, and you work with kids a lot and with parents as well. Today's topic, we were talking about the family reaction to their children's illness. Now, from your experience in the hospital, what do you normally observe from parents?
Well, I think probably we can categorize these two three of parents, how they perceive. And it's hard to adapt them.
Yes.
Yeah, do you hear me?
Yes, I can hear.
Yes, we do.
Do you hear me?
Yes,
we do.
Yes, we can.
Yeah, what I said, there's a group of people whom they accept and they try to adapt themselves to the new disease and the new life adaptation, which will go with the disease. Mm. And the other category, whom they will have, a shock-like state and then a denial state when they really, they feel the thing that's been told is not real, and they need to look for a second opinion and looking for around to get a better news than what we ever tell them. Mm-hmm. And the other,
go ahead, Dr. Sir.
Yeah, the other, category minority of people, probably they don't believe at all in the diagnosis, and immediately they will jump, to think of going abroad to get a second opinion. Mm-hmm. And, they will be on that reaction, and they might take steps further, booking their flight and so on to do the same. Mm. Sorry?
Yes, now, Dr. Salim, we were discussing about breaking the news and how effective is that to, maybe ease the grievous process for parents when they hear it for the first time.
This involves the communication. The communication, to a great degree, it really relies on the manner that how you deliver this news to them. Mm. If the person is really kind enough and take the parents aside and cool them down, and then put the same facts in a way that doesn't hurt them, but delivering the medical facts as it is, that is probably the best way to do it. However, if it comes, directly straightforward and say this, child has that and that immediately, obviously there will be a reaction, might be negatively affecting even a patient care in the future. So the manner how to do it is really the cornerstone for your achievement, to what you want from the parents in terms of compliance and support for the treatment of the child.
When it comes to the illness itself to the children, does the hospital provide any sort of support in terms of consultation on what the parents need to do next, in terms of finding out more about this illness, going to particular therapy or treatment for the child? Like last week we were talking about Down syndrome, and we were discussing that it was very, very essential for the children to have physiotherapy at an early stage of birth, after giving birth, so that it helps them to be able to cope and to be able to move and walk like normal children.
If you think of rehabilitation from a disease, to some extent is a therapy, rehabilitation is there. However, the side rehabilitation, which basically, if you give that example of Down syndrome, their treatment doesn't rely only on treating the condition like congenital heart disease or endocrine disease, whatever it is, or repeated chest infections. They will need a special schooling. They will need a rehabilitation in terms of occupational therapy and speech therapy and so on.
Yes.
The last bit of what I have said is not really available and doesn't rely on the responsibility of the Minister of Health, because this is a community need, and services have to be developed. Part of it rely on other, parties in the government, but also there is a great responsibility on the community itself. For example, accepting these sort of, special need children, and then finding for them a way to live, close to normal life in the community.
Yeah, but would you agree with us that, Dr. Salim, that the community needs to be educated as well? Because, as you know, they don't have the medical background. They're just like volunteers or people who are learning, who have been through these circumstances, and they were forced into these circumstances so that they had to adapt to certain ways of taking care of their children. So maybe from the medical terms, they need to be educated and they need to be guided so that they can help their children.
Certainly, I do agree totally with you. I mean, the community needs a lot of education, from that perspective. However, because this is going to have, sort of initiative which comes from the individuals themselves, then once that, say, readiness to, to get the facts and act on them, then the information is available. And the task of the physicians, for in that aspect is to guide them, for the major aspect. However, there are, websites which we can also refer to, and they really learn a lot from the net, from that aspect. But the things that which we are slightly, lacking in our community is that they don't have, the initiation of the voluntary work, except from few people which started in the recent years, and I hope that's going to spread more commonly, particularly in the regions, because the special needs children is not only in Muscat, they are all over the Sultanate.
Yes, we do agree, Dr. Salim. This is Wa'il with you, Al-Harasi. I totally agree with you that there is need for a community to have greater knowledge and greater awareness of how to deal with children with disability. However, we both understand that this will take really very long time, and I think it should start from people with knowledge, and I think the most qualified people to start this with the community are doctors. We actually blamed doctors to be frank with you in the past few episodes of this show, because we heard of stories from well-read, well-educated parents who think that who haven't got the initial treatment that they anticipated, and they felt that they were a little bit let down. Do you think that we need to improve in our hospitals to have better support for parents during the first stages?
For sure, I do agree with you. We need to improve our communication. However, from experience, what I have noted, when you break the news, the parents will grab probably 10 to 20% of whatever you have said, and not uncommonly you find them probably they misunderstood you.
Yes.
So repeated, counseling it has to be consistent and along the way to spread that knowledge.
Exactly, counseling. You said
however,
counseling. Do we have?
We expect from the parents, to go somehow to come prepared. So when you communicate, then they grasp most of the things that you are talking about. And if you have query or have in doubt and they don't understand what you are talking about, it's better to clarify it in the same sitting rather than to go with wrong information or image about exactly what's happening to the child.
Absolutely.
So it is I think it is a dual responsibility on both parties. You have the parents and you have the physicians who are responsible to deliver the exact medical facts. Beside treating the child, whatever treatment he deserves to have.
How strong?
And the parents also they have to have that initiative of really trying to understand what's happening to their child, either from the doctors or from the other resources.
Dr. Salim, how strong do you think the task force, the counseling task force, is in the long run for families in Oman? If you were to rate it from 1 to 10, what is our status here in Oman? 10 being the absolutely brilliant. How would you rate it? Counseling for parents?
Probably, I would say we are in around 5 to 6 of 10.
Okay. How can we, normal Omanis, normal citizens, how can we help you improve?
I see the doctor is, he is a doctor wherever he goes.
Yes.
He's not only bound to his institute, a health center or a hospital. So he's carrying the knowledge, and that whenever he gets opportunity, he has to spread this knowledge, and the facts should remain facts. Whenever, and that is the way how to go about it. Sometimes, you find, a discussion in the social gathering, which goes really around, say, targeted objectives, is just to kill the time and to vent of whatever stories they have heard about. So here comes the responsibility of the physician or whoever is around to really correct the facts.
Yeah.
And that's how we can spread the knowledge, more than just being in a busy hours when you are really at work, and that is obviously part of the treatment is that to give education, but you have to go outside that boundary.
Thank you very much, Dr. Salim. One final question from me is that you mentioned earlier there are 3 groups of parents when the news is broken to them. Parents who are accepting or denial or in dire shock. What are the common features in all of these 3 groups from your experience?
I would say that probably if I can divide them of 10, I will find the accepting parents about 4 of 10, and the denying about 3, and the other remaining 3 will be those are really not only denying, are disregarding the diagnosis, and they are trying to get a better opinion or a different. Hello?
Yes, we can hear you.
Yeah, finding an opinion which suits their wishes, particularly when it comes to the chronic diseases.
Thank you very much. Thank you very much, Dr. Salim Al-Maskari. It has been an honor to have you here. We appreciate your very busy schedule. So thank you very much from me and Hatim and Dr. Harith here in the show. Salam
Thank you. Thanks a lot. Alaikum salam wa barakatuh.
I wanted to thank him as well for my son treatment was in Royal Hospital, and the the treatment worked, or the whole team worked their best actually to provide for my son. And looking back at the whole, almost the last 1 year, I think although there are parts that I agree with you could have been improved, but the overall experience, the overall outcome was for the benefit of our son. So in going through an experience of a sick child, sometimes we tend to over press on certain issues, like the way something was served, the way someone spoke to me, the way someone dressed, the room.
You make me laugh here, because I remember an incident where I took my child to a hospital, and he had his tonsils taken out. And you can't have hard food, only soft food. And they brought him chicken to eat. Okay, and it was fried chicken, hard, tough chicken to eat, and he was just 3 years old. And they said, "But he can't eat this." They said, "Well, that's all we have."
but in a hospital, a while is actually a very complicated system for the chicken to reach you. It had to be, an order was supposed to be made. Someone was supposed to bring it. Loads of things can happen.
I mean, I can cook mashed potatoes, no problem.
Yes. and like for your son, I think the overall experience of getting the tonsils out, he made recovery.
It was brilliant, I must say. The chicken was just
So and that part is actually very important, because the services that we have, they do benefit a lot of people. It's not for the service to benefit me, made me appreciate how important they are for us. Not many of us can afford to pay so much amount to go somewhere else. And by just saying or focusing on the part where, let's say, I'm not picking on you, but if you'll tell someone about the chicken story, they will keep. It might become a joke, someone might say it to someone, and they will omit the overall picture that a child who was having recurrent tonsillitis, who was not picking up weight, who was really having...
By the way, he couldn't even speak. And we thought he had speech problems as soon as the tonsils was taken out. And
so they've removed the adenoids as well, I think.
Dr. Wael was just nagging about the chicken, but he enjoyed it very well.
I ate the chicken, by the way. I ate it. I enjoyed it.
So that's an important part where we as parents, we tend to be affected by the things we hear. And a lot of times we need to weigh the things that we hear. Do they really make sense or not? And then should we consider them when we make decision about the treatment of our child or not? And then we need to be responsible as well. A lot of the things that, let's say, I've noticed, I've written them down. And I've written them and gave them to the in-charge nurse. I gave them to the in-charge doctor. I gave them even to the hospital director, saying that I've noticed so and so and so. And this can be improved in certain way, and they actually took my comments, and instead of another parents being served chicken, as you say, I'm not going to forget about the chicken. So next time we'll make sure that something like that never happens. And I think it is the responsibility of all of us to make these services
rather than complain outside. It's better to complain
through the right channels.
Through the right channels.
I think in the last few minutes that we have on the show, we would like to ask Dr. Harith to tell us if he has any experiences with parents coming to the hospital with their sick child. Have you had any experiences with parents, Dr. Harith?
Yes, definitely. I've worked before in A&E departments, and a lot of the times pediatric cases coming to A&E, to the hospitals, either to the A&E or to the OPDs, is actually a very common scene. And each one of them, when I see them, actually I can relate to them now.
Yes.
I can think, when they become a bit aggressive or when become a bit tempered, it's not that they are not nice people. It's actually the stress that they have, the concern that runs in their mind. It just makes me more calm and more understanding.
And sometimes a person like you, to be honest, you are very calm when you speak. You're not like me. You're very calm. It just makes me more angry sometimes as a parent. To see he doesn't care. He doesn't care about my child. I'm screaming, I'm yelling. And look how calm is he.
Make sure when Dr. Weil comes with his child to the hospital, you disappear. No. You don't entertain him.
Yeah.
Otherwise he's going to give you a hard time.
No, I'm telling you this because some parents might see the calmness of the doctor as that he doesn't care. But what we need to tell parents is that his calmness is actually the way he's going to help your child. If he's not calm, he wouldn't be able to help. He might make the wrong decision.
He need to be rational while dealing with your...
Yes.
If he's too emotional, then it might actually vague his decision as much it vagues your vision to the whole...
If you allow me to ask Dr. Harith, have you ever been insulted in a hospital by a parent?
Parents, it happens, but...
how do you react to that?
Usually it's a lot of... just recently, someone was very angry, came to my clinic and said, I want this prescription to be made. And I was telling him, I'm sorry, but we are clinic of this specialty and this medication is prescribed by those people. You are following up there. And he couldn't, he couldn't understand. So I had just to repeat and explain to him in detail, saying that, no, so and so and so. Second time, he was a bit more calm. He said, okay, what I'm supposed to do. And I told him, now, the people who will be helpful to you is A, B, C, D. If you need any help, please, go to them. If nothing has happened, if they couldn't help you, you still have the hospital director. You have the patient services. We need to show people that they have ways to complain.
Yeah.
And we need to assure them that if they complained, their complaints will be taken actually seriously and they will be addressed.
Dr. Harith Al-Harthi, thank you very much for joining us today. For sure, me and Dr. Weil have enjoyed it, although I didn't enjoy the chicken joke. But, and also we'd like to thank Dr. Salim Al-Miskri for joining us today and sharing some light on some issues regarding parents and their reaction to the illness of their children. Thank you very much, Dr. Harith, and I hope this is not the last time we have you on the show.
Thank you very much.
Thank you very much.
Dear brothers and sisters, thank you very much for listening to us. See you next week, inshallah, from me, Hatim Al-Absalam.
And Wa'il Al-Harrasi. Assalamu alaikum.
The Modern Family. The Modern Family. Let us bridge the gap between generations. Let us shape up the modern family.